Hello, I'm Dr. Mark Dailey. If you're watching this DVD, then someone you know sincerely cares about your health. During the few minutes I have with you, I'm going to give you an overview of the kind of conditions I treat, as well as the most common causes of these conditions. Of course, it's impossible to diagnose your specific condition without seeing you in person, but I'll give you an idea of the possible causes. I'm also going to tell you a little bit about myself, so you have an idea who I am in the event that you choose to come in and take advantage of the offer at the end of this recording. You'll also hear from real patients who have benefited from care in our facility. We will touch on the type of treatment we offer as well as some treatment options. As for me, I was raised in Miami, Florida. I have 7 kids altogether. I got my chiropractic degree at Life College in Marietta, Georgia. To become a chiropractor, I took 4 different national board examinations and 2 state board examinations, one in Georgia, one in Alabama. I moved to Alabama in 1997 to work with one of the top SOT practitioners in the country. I worked with him for several years, opened this office in Springville, then another office in Hoover. At this point, I'm in Springville 6 half-days a week, and in Rainbow City 3 afternoons a week. I love what I do, and I'm passionate about helping people enjoy healthy living. Now, I'm going to say a few things that may seem like I'm against the medical profession, but nothing could be further from the truth. My grandfather was a medical doctor and a strong influence on me. He was a cardiologist and the chief of staff at Mount Sinai Hospital in Miami, Florida. My sister is a pediatrician, and they're both warm and caring people. Now, I have had the pleasure of personally helping thousands of people over the course of the last 12-13 years between our Springville, Hoover, and Rainbow City offices. We've addressed conditions from headaches, migraines, neck pain, carpal tunnel syndrome, upper and lower back pain, numbness and tingling in the hands and feet, fibromyalgia, chronic fatigue syndrome, and many more. Over the last few years, I've consulted with a number of companies to help them reduce spinal injuries in the workplace and show them how to minimize an injury when one occurs. Companies like Coca-Cola, Bluebell Ice Cream, Miss Stratton's Salad, Stewart Machine Shop, Merita Bakery, Elastic Corporation of America, Spring Air Mattress Company, Tricon Metals and Services, Prax Air, Webb Styles, Industrial Galvanizers, Valspar Coating, Revere Control Systems, Stevens Graphics, NTA Graphics South, Certainty, Roan Incorporated, Nexcel, J Mid-South, Regulus, Choice Fabricators, and Keystone Foods. Now, as you can see, the list of companies I've consulted with is long. Now, you can look at letters of recommendation from these companies. You can view them online at workplacewellnessonline.com. Now, most people who come into my office actually have an underlying condition that's causing their pain. It's usually a structural misalignment that predisposes them to have back or neck pain, or whatever symptom they're experiencing. Let me give you an example of a structural misalignment. If you were driving a car with the front end out of alignment, your tires would be predisposed to wear out quickly in places they weren't designed to wear. You could turn up the radio so you don't hear the noise of the tires. You can change the oil, you can flush the radiator, but anything short of having the front end of your car aligned will do you no good. Now, in the same respect, if your spine is misaligned, it'll cause the discs and the vertebra to wear out before they should. This is called degenerative disc or joint disease. This actually causes a cascade of problems which might include muscular imbalances, muscle spasms, inflammation, which in turn can cause stiffness, decreased range of motion, nerve irritation, which may result in a burning, a tingling, a throbbing, a numbness. It can be sharp and stabbing or a dull ache. But if you do in fact have degenerative joint or disc disease as the underlying cause of your pain, the medical profession in general would suggest that you take pain pills, anti-inflammatories, muscle relaxers, that you might have a nerve block or even spinal surgery. But anything short of bringing the spine back into proper alignment, just like the front end of the automobile, won't fix the problem. Your spine will continue to wear out even if you're unaware. Now, I I don't want you to be misled. This is a progressive degenerative disorder, which means it gets worse in time, not better. Now, let me be honest. People come to see me because they're in pain. Their motivation is to get free from pain, period. What they often find is that they have this underlying condition that must be corrected, or their future will most likely be filled with persistent, chronic pain. What I see in these people over the years is that their pain gets more intense, and that the bouts with the pain tend to happen more frequently. So what do we do here in our office to correct these types of structural misalignments and help these kind of patients? Well, first and foremost, we use the chiropractic adjustment to restore proper motion in the spinal vertebra and bring the spine and hips back into proper alignment. We use spinal decompression tables to take pressure off the nerve roots, to decompress and nourish the discs, to reduce inflammation and restore proper motion. We have 2 decompression suites. The tables we use are state-of-the-art, computerized, and very comfortable. The sessions are about 20 minutes. It is very relaxing and very enjoyable. We also use electric muscle stimulation as well as moist heat treatments. This is like an electronic massage. It's designed to increase circulation, reduce inflammation, and relax the muscles involved in your condition. We use ultrasound as well for the reduction of inflammation to increase circulation and relax the muscles. We also use this for heel spurs. It's been very, very effective. We have spinalators that our patients lay down on and actually have a massage. It's very, very enjoyable and very relaxing. It makes sure each segment of the spine is moving properly. We use full body vibrators that have been shown to reverse osteoporosis, to increase blood oxygen levels and to increase circulation and reduce edema. We use oxygen therapy with our spinal decompression. The cerebellum is the most oxygen-dependent part of your brain, and it controls the postural muscles as well as your balance and coordination. Oxygen helps to restore balance in the 2 hemispheres of the cerebellum and can reduce muscle spasms and restore muscular balance. We use oxygen with exercise for the same reason noted above on our treadmill or one of our upper body ergometers. We also use auricular therapy. We stimulate acupressure points on your earlobe that correlate with specific body parts to restore proper flow of energy. As you can see, we have many ways to help our patients overcome their specific health issues. Now, in our office, we offer 2 different kinds of care. We offer relief care, which is meant to get the patients over their immediate pain and hopefully provide some stability, but not much more. We also offer corrective care, which is meant to get the patient free from pain first and foremost, and then to establish structural stability, then finally make a structural change that stops the degenerative process in its tracks. Now, again, with relief care, the goal is just that, relief from pain. With corrective care, our goal is to bring relief, provide structural stability, make a structural change to stop the degenerative process. Now, although I offer 2 kinds of care, I always recommend corrective care for people who need corrective care. Because if we don't make a structural change and provide spinal stability, it's only a matter of time before the pain returns and the degenerative process resumes. Now, of course, the choice is always up to the patient, but I want to be clear on the options so that I can get in line with your goals. Now, I will say that millions of people have found relief without the use of drugs or surgery, with all natural chiropractic care. This includes celebrities like Joe Montana, Mel Gibson, Bob Hope, Sylvester Stallone, Demi Moore, Kim Basinger, Whoopi Goldberg, Steven Seagal, Jerry Seinfeld, Denzel Washington, Cher, Madonna, Michael Jordan, Tiger Woods. Of course, I have had the pleasure of working with many athletes from the University of Alabama. I want you to hear what some of your neighbors and my patients have to say about care in our office.